What if we could fight cancer with the precision of a laser beam, targeting only the diseased cells while leaving healthy tissue untouched? What if this treatment not only destroyed the primary tumor, but also trained our own immune system to hunt down and eliminate cancer throughout the body? This isn't science fiction. This is the rapidly evolving world of phototherapy, and it's changing the very definition of cancer treatment. For decades, the main pillars of cancer treatment have been surgery, radiation, and chemotherapy. Powerful, but often brutal. Phototherapy is emerging not just as an alternative, but as a uniquely powerful partner that enhances these traditional methods. Its mechanism is completely different, which means it can be safely combined to create a multi-front attack on cancer. Think of it like this. Photodynamic therapy, or PDT, can make cancer cells more permeable, like opening a door for chemotherapy drugs to rush in. This can lead to synergistic effects, meaning we can use lower, safer doses of chemo. When paired with radiation, another local therapy, it enhances tumor destruction without causing the kind of DNA damage that leads to radioresistance. It can even be used with surgery, either before an operation to shrink a tumor and make it easier to remove, or afterward to clean up any microscopic cancer cells left behind. But the most exciting combination is with immunotherapy. PDT can cause a specific type of cancer cell death that rings an alarm bell for the immune system. It can turn what scientists call cold tumors, those invisible to our immune defenses, into hot tumors that are suddenly lit up, ready to be attacked by powerful immunotherapy drugs. This synergy is a cornerstone of modern oncology. But the story doesn't stop there. The entire field is in a state of hyper-evolution, driven by breakthroughs in nanotechnology and optics. Imagine carriers thousands of times smaller than a human hair, designed to revolutionize how we use light to fight cancer. These are nanoparticles. Many of the best light-activated drugs, called photosensitizers, don't dissolve well in our bloodstream. Encapsulating them in nanoparticles solves this, allowing for effective delivery throughout the body. But it gets better. These nanoparticles can be decorated with targeting molecules, like tiny guided missiles that seek out and bind only to cancer cells. This dramatically increases the drug concentration exactly where it's needed, maximizing effectiveness while minimizing side effects. Some can even be loaded with multiple agents at once: a photosensitizer, a chemo drug, and a diagnostic agent, creating a single theranostic platform that can diagnose and treat the tumor in one go. They are even being designed to overcome one of PDT's main limitations: the low oxygen environment inside tumors. Some nanoparticles carry compounds that generate oxygen on site, fueling the light-based reaction and making the treatment far more potent. A major historical challenge for phototherapy has been the shallow penetration of visible light. You can't treat a deep pancreatic tumor with a flashlight. But researchers have found incredibly clever ways to get around this. One of the most exciting is the use of upconversion nanoparticles, or UCNPs. These special particles can absorb low-energy near-infrared light, which travels deep into body tissue, and convert it into high-energy visible light right at the tumor site. It's like having tiny internal light bulbs that you can switch on from the outside, non-invasively. Another advanced technique is called two-photon excitation. It uses a high-intensity laser to deliver 2 photons of low-energy light to the photosensitizer almost simultaneously. The combined energy of these 2 photons activates the drug. The magic here is that this only happens at the laser's precise focal point, allowing for targeting with subcellular accuracy, true 3D precision. And for the deepest tumors, scientists are even looking beyond light. Sonodynamic therapy uses low-intensity focused ultrasound to activate drugs called sonosensitizers. Since ultrasound penetrates tissue exceptionally well, this opens a pathway to treat almost any tumor in the body, non-invasively. This brings us to what many believe is the ultimate synergy: photoimmunotherapy, or PIT. This strategy combines the precision of targeted therapy, the cell-killing power of phototherapy, and the long-lasting effect of immunotherapy into one elegant package. Here's how it works. Scientists create a conjugate by linking a photoabsorbing molecule to a monoclonal antibody. This antibody is engineered to specifically target a protein found only on the surface of cancer cells. When this conjugate is injected, it circulates through the body, ignoring healthy cells and latching exclusively onto the cancer cells. Then, near-infrared light is shown on the tumor. The photoabsorber is activated, causing immediate, physical damage to the cancer cell's membrane. The cell essentially bursts and dies instantly. But crucially, this type of cell death is highly immunogenic. It releases a flood of tumor antigens and alarm signals that recruit and activate the body's own immune cells. This creates a powerful systemic immune response that can seek out and destroy not just the primary tumor that was treated with light, but also distant metastases. This isn't just a theory. A treatment for head and neck cancer using this exact principle has already been approved in Japan and is in late-stage clinical trials in the United States, showcasing its immense potential. So what does this all mean for a patient? Let's walk through the journey. It begins with a consultation to determine if a patient's specific cancer, its type, size, and location, is a good candidate. Once approved, the first step is the administration of the photosensitizing drug, either as an IV infusion, a topical cream, or sometimes an oral pill. Then comes a waiting period, from a few hours to a few days, called the drug-to-light interval. During this time, the drug clears from most healthy tissues, but is selectively retained by the cancer cells. This period is critical because it also makes the patient highly sensitive to light. This is the most important responsibility for the patient. They must strictly avoid direct sunlight and even bright indoor lights. They'll wear protective clothing, hats, and sunglasses to prevent skin reactions. After the waiting period, the patient returns for the light treatment. For skin cancer, an LED panel might be placed over the area for about 15 to 20 minutes. For internal cancers, a thin fiber optic is guided through an endoscope directly to the tumor. The patient might feel a stinging or burning sensation as the drug is activated, but this is managed to ensure comfort. Recovery is generally much faster than with major surgery or chemo. The treated area might look and feel like a sunburn, and for internal treatments, there might be some temporary inflammation. The patient must continue to avoid light for a few weeks, but the overall process is far less arduous, allowing for a much better quality of life during treatment. The true power of phototherapy lies in its elegant specificity. By combining drugs that target tumors with light that can be precisely aimed, it unleashes its destructive power with an accuracy that was once unimaginable. This means fewer debilitating side effects, better cosmetic results, and the preservation of healthy organs. The integration of nanotechnology is creating smart bombs for cancer. Advanced optics and even ultrasound are breaking the depth barrier, allowing us to reach previously untreatable tumors. And most profoundly, the synergy with our own immune system is unlocking the potential to not just control, but to generate long-term systemic responses against metastatic disease. The future of cancer treatment is moving away from the sledgehammer approaches of the past towards a new era of personalized, precise, and powerful medicine. It is a future that is, in every sense of the word, looking brighter than ever.